COVID is kind of at the center of everyone's attention. I mean, it doesn't matter how much murder hornets, swine flu, or some other reemergence of Ebola try to take credit. COVID still rules the roost right now, and it has greatly impacted everywhere around the world. And there was a point in time where New York was the epicenter. So I'm currently at Mount Sinai Hospital, and we have a system and quite a large number of hospitals. And we peaked on April 9th of this year with over 2,200 patients admitted to the hospital for COVID and COVID-related problems. Right now, we're down to probably fewer than 10. It's really been a dramatic change over the last few months. And credit to the administration, the nurses, doctors, and staff here to supporting everyone through that. We didn't get overloaded. We had PPE. It was stressful, but as a community, we got through this big first wave of it. But it really did impact the way that we managed our myeloma patients. And I can talk a little bit about that, as we have two papers that are in the process of hopefully getting published soon. One is our internal paper, and the other is actually a collaboration with Memorial Sloan Kettering, us at Mount Sinai, Cornell, Columbia, and NYU, basically looking at the global experience or the New York experience of myeloma programs. And we actually have a lot of patients between us, hundreds of them. And, one of the things that we did, at least in clinical practice, is we switched a lot of people to oral therapies. So we used a lot more Ninlaro over the last few months than we had previously. We tried to limit the number of parenteral therapies. So patients who were on Darzalex, we really pushed them to the monthly dosing, switched over to subcutaneous Darzalex dosing as quickly as possible to minimize their time interaction with the healthcare system. Some people, we simply held the drug. Darzalex has a long half-life, maybe 19 days or so. So if you skip a dose or two and you're in complete remission, it's still circulating in your system. Use a lot more oral triplets, ixazomib cytoxin dex, ixazomib pomalidomide dex. Use a lot more Faradak lenalidomide dex. We use more selinexor dex. So we really try to minimize our patients' interaction with the healthcare system. And what we found is, for a lot of patients, we were able to keep them away. Unfortunately, the morbidity and mortality rates in myeloma patients is substantially higher than their age-matched cohorts. And this is part of the reason with their immune dysfunction that we were really worried about them. The interesting thing that came out of a lot of this was it wasn't exactly just the patients you would think that got the sickest. It wasn't the patients who were end-stage myeloma, no other options, immune system blown out. It wasn't necessarily those people who got the sickest. It was actually some of the early on patients who were in remission. And at first, it's kind of a little difficult to think about it, but one of the things that we saw was a very clear parallel between CAR Ts and COVID. In CAR Ts, where you get T cells activated, they interact with other cells like macrophages and cause something called CRS, cytokine release syndrome, which we manage with anti-interleukin drugs like tocilizumab, siltuximab, anakinra, and so on. COVID appears to have three general phases. It has a viremic phase, where the virus is very high in the blood. That leads to intense inflammatory phase. And then it can kind of peter off into a fibrotic phase. But in that middle inflammatory phase, it very much mirrors the milieu of a CAR T patient having cytokine release. So one of the things we did at our institution is we had a real-time ELA probe that looked towards measuring real-time cytokine levels that had been designed for CAR Ts. We switched that over to be utilized for COVID patients. So we were able to assess COVID patients real-time interleukin-1, interleukin-6, TNF-alpha, TGF-beta, and make clinical decisions and therapeutic interventions based off of this real-time data, and literally manage COVID patients as if they had just had a CAR T developing CRS. So we really learned a lot about, instead of guessing or using indirect measurements like CRP and ferritin, we're able to use real-time interleukin monitoring and ended up having to use drugs like tocilizumab and anakinra for some of our COVID patients. We unfortunately learned a lot through a very difficult way, and has been quite tough. But again, it was very important that we learned that really try to keep people away from the healthcare system as much as possible.